Hi, I'm Dr. Chopra.
And I'm Dr. Ronaldo.
Today we're going to talk to you about shock. Shock refers to organs and tissues of the body not receiving a sufficient flow of blood. As a result, there's an imbalance of oxygen and a buildup of waste product, and that can damage the organ.
Some of the symptoms of shock are an extremely low blood pressure, feeling weak or nauseous, chest pain, fast but weak pulse, profuse sweating, dizziness, faintness or light headache, moist, clammy skin, unconsciousness, rapid shallow bleeding, feeling anxious, agitated or confused, blue lips,
Stages of
or
shock
feeble
include Stage 1, initial stage of shock. Stage 2, compensatory stage of shock. Stage 3, progressive stage of shock. Stage 4, refractory. 4 stages of shock. Stage 1, the initial stage of shock. The initial stage of shock is irreversible, but does not show any obvious signs and symptoms that would indicate the body is entering a stage of shock. Stage 2 is compensatory stage of shock. During this stage, the body tries to reverse the results of the initial stage. Stage 3 is progressive stage. And if the shock progresses to the third stage, damage to the body is more severe. Stage 4 is refractory. If the stage cannot be fixed, the body will inevitably last on the last stage and organs will fail.
There are some various types of shock, such as cardiogenic shock, which occurs when the heart is severely damaged by a heart attack or heart failure. Hypovolemic shock occurs when the total volume of blood in the body drops below normal. Hemorrhagic shock occurs as a result of a hemorrhage due to physical trauma. Neurogenic shock occurs specifically from trauma that leads to spinal cord injuries. Septic shock occurs when bacterial infection causes shock syndrome, blood pressure drops, damage to the lungs, causing acute respiratory distress. And anaphylactic shock caused by a severe allergic reaction, such as a bee sting or consumption of a shellfish or a
shock, treatment is needed immediately. You will first call a doctor and enable emergency services. Check the person's rate of breathing and circulation every 5 minutes. If the person is experiencing trouble breathing, begin CPR. Lay the person flat on their back and raise their legs. This is known as the modified Trendelenburg position, and you will raise the legs about 25 centimeters. This will help restore the blood pressure. If the person is conscious but has trouble breathing, please help them in a sitting position. Administer first aid treatment to wounds when using illnesses. Loosen tight clothing and keep the person warm and comfortable. Do not give the person food or liquids to prevent inhalation of vomiting. Emergency treatment would involve the person in shock being hospitalized. Treating shock will include temperature control, give fluids and blood intravenously to improve blood flow, extra oxygen is administered, and to deal with underlying conditions such as heart problems, drug or addiction.
Next time you see something about shock, you'll know how to prevent and treat it. So hopefully you learned something good from this video, and that's the way the cookie crumbles, folks.